Hello, Fresno. It's Central Valley Business. What a great show we got today. My first guest is Dr. Walters, MD, and
Yes, sir.
You got an incredible program, Doc.
Yeah, excited about the program. First, I'd like to introduce one of our volunteers, Celso Macias. He's also our Spanish interpreter. This is Daisy Slavokracheva, one of our board members, and this is our newest hire, Kimberly Stokes.
Welcome.
She was our Director of Volunteer Services.
Welcome. And this is Volunteers for Humanity. You started in May of 2013.
Yes, sir.
Okay.
Yes, sir.
Tell us how this came about, what you do.
So basically, I think most healthcare professionals have a dream of volunteering and going to help other people. I think that's why we initially got into the business, to help others.
Mm-hmm.
So I thought about what could I do to contribute to providing health abroad, especially now that there's so much equipment that we have left over. New device comes in, the old one we shelf, but that old one is still good to be used in another place.
Right.
So I started this actually in April 2012. That's when my first letter went out to the Embassy of Uganda in Washington, D.C., telling them about what I would like to do.
Right.
And they took it from there. They contacted one of their hospitals in Lira, Uganda, and we went to Lira, Uganda, which is in northern Uganda, to provide medical and dental care.
Great.
So, yeah. So
Now, that was your first mission.
that was our first mission,
You've
which
had a
was in
second
April. Yes, sir. It was to Kenya this summer. This is the one that Mr. Macias was on.
Oh.
Yeah, and that was absolutely wonderful. We went there to establish a freestanding medical clinic outside of the district hospital, which is called Kitale District Hospital, and we also went there in order to change the way that they are isolating patients, in that.
Like patients have communicable diseases, that type of thing?
Yes, in the pediatric unit, which I was very surprised.
Mhm.
It's a large unit, and it's cut up into sections.
Mhm.
So one section will be the flu section, one section will be TB, one will be malnutrition, one will be for parasitic disorders.
It's all in
There's
the same
nothing else.
room?
All in the same room, no walls are separating them, and in the beds, they'll have 2, 3, 4 children in one bed.
So we can pass the flu and TB right on
Exactly.
down to the malnourished people, which would be the most
Exactly.
susceptible. And
Exactly,
on and on.
exactly.
And you were able to make some changes.
Yeah,
with this.
yeah. We made some changes, some short-term changes. Now we're trying to work with USAID and
Mhm.
other organizations in order to either get them a new building for the pediatric section, or to figure out a way how we can better divide that area up, so that when one child comes there, we will take his problem and not add
Right.
additional problem to that child.
Doc, how much support have you gotten?
Tremendous. Oh my gosh. I was absolutely amazed, because initially when I started it, our mission statement or slogan is to provide free medical and dental care to underserved and impoverished areas worldwide. My brother, Dr. Malcolm Walters, is a dentist. I do anesthesia. So I said, worst come to worst, we can go over there and do something. So
Great.
yeah, so once I started it, we had the tremendous support from Tulare District Hospital. They got a lot of those supplies when King's Hospital stopped being of service. So we got a lot of that equipment. Can't say enough about community medical centers. They have just been tremendous.
So your support, a lot of the supports come from right here in the Central Valley?
Oh, yes, sir. Yes, sir. Our 3 major hospitals, Tulare District, CMC Group, and Quia Delta Hospital. They have been donating a lot of stuff.
So
there.
from Fresno,
Yeah.
we make a difference in the world.
Oh, 100%.
Oh, that's great.
Absolutely. We couldn't do it without them.
No, that's
We couldn't do it.
wonderful.
Yeah.
How about outside the area? Are you getting much help from out? Are there grants or programs?
Yeah,
and stuff?
was great. Our first mission, my brother, as I said, he's a dentist in Cleveland,
Right.
and he has an association with LeBron James and LeBron James's coach.
Cool.
So Mr. James was generous enough to donate 6 large boxes of NBA paraphernalia with his name on it. Now, I can't tell you, that's like gold. That's like gold.
Yeah.
So
Yeah.
we bring the boxes over, and we have them sitting like in the room while we're doing surgery, and we have to count them because they were saying, "Well, yes, I know they're for the kids, but hey, but this is LeBron James." They said we want something too. So that was kind of funny, but yeah, a lot of support. Dallas Cowboy, Justin Durant, his brother plays for Saskatchewan Roughriders, Darian Durant. They'll be going on a mission with us.
You're going to join
summer.
you?
Yeah,
Cool.
they're going to join us this summer. Yeah.
Oh, that's great.
Fantastic. Yeah, I'm excited.
Can I stand in line and get autographs?
Yes, no, hey, you can come too.
All right. Listen,
Uh-huh.
when you go into a place like this,
Right.
where they don't have the ready availability, they don't have the consciousness that
Right.
someone here has, going to the hospital. How
sure.
are you received there? Not only by the professional people,
Right.
but by the local people.
Right. Well, I tell you, I'll talk about the first mission. So our first mission, we picked Uganda because I have a relative that works in Uganda. So had somebody that could scout out the area. They told us we don't go through organizations or individuals. We go through governments.
Okay.
So we contacted the embassy. The embassy gave us Lira Regional Referral Hospital. They checked on it. At that time, I did not know that was the northern Uganda area where they had that conflict or revolution
Right.
for like 20 years. So when he gave me that hospital, I said, "Oh, wow, that's where we're going." But she checked it out and she said, "Well, it's pretty stable now." So we flew over. The government took us to Lira from Kampala, and we went there and we did dentistry, obstetrics, and gynecologic surgery. Some of those videos are actually on our website. But the people were absolutely wonderful. The funny thing is, after I finished surgery in a day, I have to work.
Yeah.
But my brother, he would go into the villages at night, and you'll see a lot of videos of him playing with the children. The children are magnetic. Makes you want to keep coming back.
You have a
coming
website?
back. Yes, sir.
What is it?
It's volunteers with a 4humanity.org or .com. So volunteers4humanity.org.
Number 4.
Yeah, number 4. Yes.
Oh, okay.
Yeah. and
Great.
that's
Well,
it.
you look this up and you do this and look at the videos. This is great.
Yeah.
So your mission now,
Right.
where are you headed to?
Right now, we're in preparation to do something in Sierra Leone. Sierra Leone, as you know, is one of the countries that was affected by Ebola.
That's right.
Sierra Leone, Liberia, and Guinea.
Uh-huh.
So we're going to the CDC. We're going to complete a course there,
Mhm.
get certified, and then we're going to go over to Sierra Leone.
Wow.
Yeah. So
And,
so it's
What a great service that you're doing.
Yeah.
Doctors.
yeah.
Doctors do service. That's
Sure.
what they do.
Sure.
And yeah, they get compensated well for it.
Right.
But a true doctor
Right.
is a true person of service.
Right.
And to be able to take that to the world
Right.
as you're doing
Right.
and have an impact.
Right.
And these fine people that are with you in the rest of your organization.
Right.
How wonderful is that?
It's absolutely lucky. Like I said, technically we've started since 2012, and I don't receive a salary.
Mhm.
They don't receive a salary. One of the things that when I started Volunteers for Humanity, I looked at some of the organizations of longevity,
Mhm.
and I looked and I saw. I tried to make my own niche
Right.
in there. So what we did is establish shorter missions. Instead of taking a salary, I used that money to get my volunteers or my staff to where we got to go or do the supplies.
Mhm.
And I like bringing. We'll bring any volunteer, but I love high school and college students to come with me because I know I can make a difference in their lives.
You betcha.
Yeah. So
All right.
that's
So Doc,
Mhm.
our time's up.
all right.
I want to thank you for being on the show today.
Thank you.
I want to thank you for what it is you're doing.
Thank you.
And as we close,
Mhm.
is there anything you want to say real quick? Look at the
Hey,
camera.
our missions for 2015 are currently forming. We will probably do a mission in the summer of 2015. It looks like we're going to be going back to Africa. So if you're interested in coming on one of our missions, please check our website repeatedly for the update and the announcement for the dates and the location. Thank you very much.
Thanks, Doc.
Okay.
Take care. We'll be back in a minute.
All right.